Welcome to the Dr. Izzy's Medical Podcast channel.
Question: how long after inflammation begins do macrophages predominate in the tissue? Answer: peak after 2 to 3 days. Question: how long after inflammation do neutrophils undergo apoptosis? Answer: within 24 hours. Question: what are the 4 major chemotractants for neutrophils? Answer: C5a, IL-8, LTB4, kinin. Question: what is a colorless nitroblue tetrazoleum, NBT, test indicative of? Answer: NADPH oxidase defect. Question: what is the genetic inheritance of Chiari-Akagashi syndrome? Answer: autosomal recessive. Question: what is the genetic inheritance of leukocyte adhesion deficiency? Answer: autosomal recessive. Question: what nitroblue tetrazoleum, NBT, test result is seen in myeloperoxidase deficiency? Answer: normal. NBT gauges NADPH oxidase actino, formation of superoxide radicals. Question: what surface proteins on leukocytes binds to ICAM-VCAM on endothelium? Answer: integrins, LFA1. Question: which 2 anti-inflammatory cytokines are released by macrophages in the resolution and healing phase of inflammation? Answer: IL-10, TGF-beta. Remember, IL-1 and TNF are the pro-inflammatory cytokines. Question: which adhesion molecules are upregulated on endothelium in inflammation by IL-1 and TNF? Answer: ICAM, VCAM. Question: which arachidonic acid metabolite mediates the delayed response of mast cell degranulation? Answer: leukotrienes. Question: which cell surface protein on leukocytes binds to selectins on endothelium? Answer: sialyl-Lewis X. Question: which cell surface protein on macrophages recognizes LPs on the outer membrane of gram-negative bacteria? Answer: CD14, co-receptor for TLR4. Question: which coagulation factor is referred to as Hagman factor? Answer: factor 12. Question: which complement pathway is activated by C1 binding to Ig or IgM bound to antigen? Answer: classical. Question: which complement pathway is activated by mannose binding lectin, MBL, binding to mannose on microorganisms? Answer: mannose binding lectin pathway. Question: which complement pathway is activated by microbial products directly? Answer: alternative. Question: which complement protein complex lyses microbes by creating a hole in the cell membrane? Answer: MAC. Question: which complement protein functions as an opsonine? Answer: SEB. Question: which complement protein is an opsonine for neutrophils? Answer: SEB. Question: which complement protein is chemotactic for neutrophils? Answer: C5a. Question: which complement proteins are known to activate mast cells? Answer: CEA, C5a. Question: which complement proteins are referred to as anaphylatoxins? Answer: CEA, C5a. Question: which cytokine released by macrophages recruits additional neutrophils? Answer: IL-8. This is typically seen at the end of acute inflammation to ensure that there is continued acute inflammation. Question: which cytokines released from macrophages in response to pyrogens increase cyclooxygenase activity? Answer: IL-1, TNF. Question: which enzyme converts arachidonic acid into prostaglandins? Answer: cyclooxygenase. Question: which enzyme in phagocytes converts H2O2 into HOCl? Answer: myeloperoxidase. Question: which enzyme in phagocytes converts O2 into superoxide? Answer: NADPH oxidase. Question: which enzyme in phagocytes converts superoxide radicals into H2O2? Answer: superoxide dismutase, SOD. Question: which enzyme releases arachidonic acid from the phospholipid cell membrane? Answer: phospholipase A2. Question: which enzymes converts arachidonic acid into leukotrienes? Answer: 5-lipoxygenase. Question: which immunoglobulin isotype functions as an opsonine? Answer: Ig. Question: which inflammatory cytokines induce E-selectin expression in endothelium? Answer: TNF, IL-1. Question: which inflammatory cytokines upregulate ICAM and VCAM adhesion molecules on endothelium in inflammation? Answer: IL-1, TNF. Question: which inflammatory mediator trigger P-selectin upregulation from Weibel-Palade bodies? Answer: histamine. Question: which inflammatory mediators upregulate integrin, LFA1, expression on adhering leukocytes? Answer: C5a, LTB4. Question: Which leukotriene functions to attract and activate neutrophils? Answer: LTB4. Question: Which prostaglandin is known to mediate pain and fever? Answer: PGE2. Question: Which selectin protein in endothelium is induced by TNF and IL-1? Answer: E-selectin. Question: Which selectin protein is released from Weibel Palade bodies in endothelium? Answer: P-selectin. Question: Which substance released from mast cell granules mediates the immediate response of mast cell degranulation? Answer: Histamine. Question: Which TLR on macrophages recognizes LPs on the outer membrane of gram-negative bacteria? Answer: TLR4, alongside CD14. Question: Which type of infection has an increased risk of manifesting in patients with myeloperoxidase deficiency? Answer: Candida. Question: Which type of inflammation arises in response to tissue necrosis? Answer: Acute inflammation. Question: Which type of inflammation is an immediate response and part of the innate immunity? Answer: Acute inflammation. Question: Which type of inflammation is characterized by the presence of edema and neutrophils in tissue? Answer: Acute. Question: What is a cutaneous complication of Chiari-Higashi syndrome that results from defective transport of melanin from melanocyte to keratinocytes? Answer: Albinism. Question: What is a breakdown product of high molecular weight kininogen that mediates vasodilation and increased vascular permeability as well as pains? Answer: Bradykinin. Question: What are complement proteins that act as anaphylatoxins, thereby triggering mast cell degranulation and histamine release? Answer: CEA and C5a. Question: Which protein trafficking disorder that presents with giant granules and leukocytes due to fusion of granules arising from the Golgi apparatus? Answer: Chiari-Higashi syndrome. Question: Which autosomal recessive protein trafficking defect characterized by an impairment in forming phagolysosomes? Answer: Chiari-Higashi syndrome. Question: What is an immunological disorder that is characterized by poor O2-dependent killing due to a NADPH oxidase deficiency? Answer: Chronic granulomatous disease. Question: What is a cardinal sign of inflammation that results from IL-1 and TNF release from activated macrophages? Answer: Fever. Question: Which enzyme that cleaves high molecular weight kininogen to bradykinin? Answer: kallikrein. Question: Which autosomal recessive immunological disorder that involves a defect in the CD18 subunit of leukocyte integrins? Answer: Leukocyte adhesion deficiency. Question: Which antimicrobial enzyme found in the secondary granules of macrophages that function to kill phagocytosed pathogens in an O2-independent manner? Answer: Lysozyme. Question: Which antimicrobial enzyme in the secondary granules of eosinophils that functions to kill pathogens in an O2-independent manner? Answer: Major basic protein. Question: Which disorder of the oxidative burst pathway that presents with the inability to make HOCl from H2O2? Answer: Myeloperoxidase deficiency. Question: Which feature of Chiari-Higashi syndrome that presents due intramedullary death of neutrophils? Answer: Neutropenia. Question: Which nuclear transcription factor that is upregulated by TLR activation and subsequently activated immune response genes? Answer: NFKB. Question: Which cardinal sign of inflammation that is mediated by bradykinin and PGE2 action sensitizing sensory nerve endings? Answer: Pain. Question: Which neurological complication of Chiari-Higashi syndrome due to defective protein trafficking causing atrophy of nerve terminals? Answer: Peripheral neuropathy. Question: Which cardinal sign of inflammation that arises due to leakage of fluid from postcapillary venules into the interstitial space? Answer: Swelling.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.